Hello, and welcome to the Children's Study Home COVID-19 Control Plan training. In the next few minutes, we are going to be doing an overview of our COVID-19 control plan that applies to all agency operations of the Children's Study Home. The framework that we are using for our COVID-19 control plan will mirror the 4-phase framework that the governor has chosen for the reopening in the state of Massachusetts. Currently, we are in phase 1 as of the date of this recording, which is May 27, 2020. For phase 1, the agency is going to continue to operate in essential agency operations only. This is the phase that we have been operating at since mid-March, when the majority of businesses, schools, etc. were closed, and we have switched to remote work and virtual connection with families and students. So while the state of Massachusetts continues to operate in phase 1, our phase 1 will be to continue essential agency operations only. School buildings will remain closed to students. Family support and stabilization programs will continue to support families remotely, and staff will continue, if possible, to work from home. Only our residential programs shall continue in normal operating mode, as they have been throughout the state of emergency. Once the state shifts into phase 2, employees will still be encouraged to work from home and to work remotely whenever possible. Family support and stabilizations will begin to open on a limited capacity to support visits and in-person programming. Again, depending on where the Department of Children and Families, the primary referral agency for those programs, what their guidance is. Schools will remain closed to students in phase 2. And we are hoping that sometime in phase 2 we will be able to make decisions related to summer programming, again, depending on the guidance that we receive from DESE. So phase 1, our current phase, is essential operations only. Not much has changed. Phase 2, there is the potential of reopening for face-to-face contact within our family support and stabilization programs, again, depending on local guidance at that time and approval from the Department of Children and Families. Schools will remain closed during phase 2. We'll address phase 3 and phase 4 operations as we get closer. Overall operational updates: social distancing. All employees, vendors, and visitors entering agency facilities are required to wear a mask and to maintain social distancing of at least 6 feet. At this time, as we are in phase 1, only essential vendors are currently allowed on site. We are not doing on-site visitation, and we are restricting visitors to campus. Residents who are in our residential programs will be encouraged to wear a mask. But under current DPH guidelines, those who, due to a behavioral health diagnosis, are unable to do so are exempted. We do not want to create behavioral escalations, behavioral crises. So staff will encourage youth to wear masks. Many youth are. However, we will not mandate it due to behavioral health concerns. And there will be visual reminders posted at public entry points and staff areas of all programs, reminding them of the social distancing and mask wearing requirements. If you are in need of additional masks or support with masks, please contact your immediate supervisor. Hygiene protocols: whenever reporting for work, staff are asked to wash their hands following CDC guidelines for at least 20 seconds and regularly throughout their day. Programs who have youth residential programs will also establish a routine hand washing protocol within the program. The facilities team is conducting daily inspections of bathroom facilities to ensure that there is adequate soap and hand sanitizing solution, and additional hand sanitizing stations have been installed at public entry points, and those will continue to be monitored regularly. Staffing operations: All staff are going to be provided with a copy of the COVID-19 control plan in its written form, as well as available to this video run through. All staff will also be provided video training on proper procedures for hand washing, mask use, and disinfection. Our ADP system will be used to distribute that information and to record compliance with training. Any employee who is sick is continued to be encouraged to stay home. Please contact your supervisor if you are experiencing symptoms. And all screening procedures that are currently in place for residential services will remain in place, the pre-work shift screening procedures. We will follow all CDC guidelines regarding a return to work for an employee who is ill or an employee who has tested positive or has been exposed to coronavirus. We will follow CDC guidelines. And we are continuing to encourage all employees who are able to work remotely to do so through at least the end of phase 2. Again, that would be the phase 2 of the Massachusetts reopening plan. For employees who are working on site, we encourage programs to have a staggered schedule to reduce the capacity, the number of employees that are in their building at any one time. And the seating for conference rooms, meeting rooms has been adjusted to allow for sufficient social distancing space. In advance of phase 2, should we begin to open up for in-person visitation, there are capacities, physical capacities, that have been adjusted on our visitation rooms, again, to allow for adequate social distancing. Please refer to those documents as published. Cleaning and disinfecting, the facilities team will continue daily disinfecting and cleaning of all program areas. In addition, staff will be provided with the materials to produce a diluted bleach solution that can be used frequently throughout the day for some of those higher touch areas like door handles, knobs, buttons, things of those things. And we have an internal system for contact tracing. Should an employee test positive for coronavirus or be exposed to coronavirus while in the workplace, Chris Langelier, Associate Director for Compliance, Training, and Quality Assurance, will assume responsibility for an internal contact tracing and notification program within the agency. If you have any questions about our COVID-19 control plan, please refer to your immediate supervisor. Thank you and have a nice day.